We'll start just with a membership practice. I can't tell you how many doctors I've talked to over time as they make the transition into membership medicine where they're actually afraid. They're like, what happens if I have a patient who doesn't get sick during the year? And so, because it's like, how will I show up and deliver value? Heretofore, it's always required a fantastic annual health assessment, build a health management plan, that's health promoting and wellness oriented in order to do that. But even still, that's an event followed maybe by some consultation. Imagine now if you're a membership practice, if you say, look, okay, as members join, maybe you pick a universally applicable device like an Aura Ring that's looking at sort of wellness data across a variety of sort of lifestyle factors. And that becomes your go-to device that you're using to create a window into that patient's life and again, tie into your coaching program. Or maybe you say, as patients come in, I'm going to look at, we've got our people that are our hypertensive patients get a blood pressure cuff. People that are on a weight program get our body composition scale. People on pursuing insulin sensitivity get a CGM program. You know what I mean? And you've got a few kind of patient archetypes that have a different device that you've pre-picked. And you always work with the same one. So your team's not constantly having to learn and listen or learn about every device people buy on Amazon. You want to maintain control. And I do think that's actually an important theme of this latter part of our conversation, even as it relates to liability. Establishing the ground rules. These are the tools we're using. These are the times of day when we're monitoring it live. And I have to say, I love the idea of having a COVID surveillance program, as do employers, by the way, to keep people from going in and out of the ER every time they feel panicked. I mean, the news has been full of just tens of thousands of claims dollars being run up by people without access to any kind of remote monitoring, just going in and out of the ER every time they feel short of breath. And so, what people have to remember is, again, documenting some basic, some foundational expectations, but recognize this is a radical upgrade in the quality of your care. I think actually at a certain point, we may be asking the question of what's the liability for not doing monitoring? And I'm not even kidding. Maybe not in 2021, but at a certain point, I think you're going to start to look pretty foolish if you're not.